All right, I think we can go ahead and get started. I think we've got a critical mass here, so we're going to go ahead and kick this off. And we will just, it'll be great. We'll have a couple intro slides before people come, and then we'll get kind of into the heart of things. So welcome, everybody. I am so grateful to have you all here today. We know that the end of the year is a incredibly busy time for all, and that there are many places that you could be right now. So we're grateful for your presence today. My name is Nicole Bellitti, and I am the technical director at YLabs. And for the past year and a half, my colleagues, Dr. Adedamola Adebayo, Theo Gibbs, and I have been working with our partners at Organon and a global advisory group to develop and launch the Climate and Sexual Reproductive Health and Rights Framework, a resource that we are incredibly excited to share with you all today. Our intention for our conversation today is that you all leave with a really firm understanding of why gender equality and women's health in particular need to be firmly embedded in the conversations, the efforts, the initiatives that we are taking to solve this global climate crisis that we are all in. And in the lead up to COP, the Global Climate Conference, we're seeing a ton of momentum around climate and health, which is incredible. I mean, this is the first year that we're having a health day at COP. But I will say that in the reports and the thought pieces and the initiatives that are coming out, the gendered impacts of climate change are not being surfaced. And this is worrisome because women and girls and gender diverse people are disproportionately affected by climate change in a series of direct and indirect ways. And we'll go through that today in the conversation and really elucidate and showcase how that is manifesting. So the framework that we're going to share today will talk you through why this focus on gender and women's health is so important and how to take action today, regardless of whether you are a funder, a researcher, an advocacy partner, or an implementer. We will spend about the first 40 minutes of our time together presenting the framework, and then we'll leave the final 15 to 20 minutes for Q&A and discussion. So if you have any questions as we go through, please submit them through the Q&A function, which I think is now working on the bottom toolbar, as we would love to hear from you. Next slide, please. So before we get started, allow me to provide a bit of background on YLabs and Organon for those of you who are meeting us for the first time. YLabs is a design and research organization based in Rwanda and the US. We work in partnership with young people around the world to address the biggest challenges to young people's health and economic opportunity. We work across disciplines of both health and design, and we work on cross-cutting issues focused on, number one, optimum health and wellness, including sexual reproductive health and mental health. Number two, economic opportunity, and of course, climate resilience. We approach this work in two ways. Number one, by supporting research, strategy, and impact to promote sector-wide support for cross-sectoral youth-driven innovation. And number two, by working with youth to co-design data-driven digital solutions that amplify youth power, agency, and opportunity. Next slide, please. So as I mentioned, the work that we will present today was done in close collaboration with our partners at Organon, a new pharmaceutical company focused on women's health. And today I have the distinct pleasure of introducing Geralyn Ritter, who is the Executive Vice President, Corporate Affairs, Sustainability, and ESG at Organon. Geralyn joined Organon from Merck, where she advised Merck's board of directors and executive team on corporate governance matters, and she also served as the president of the Merck Foundation. But beyond her professional achievements, which are many, she is a fierce advocate for health equity, women's leadership, sustainability, corporate responsibility, and importantly, integrated action in climate change and women's health. We are so delighted to have her here to share some opening remarks. Geralyn, over to you.
Thank you, Nicole, for that very generous introduction. I'll say a little bit more about Organon in this project, and then we'll dive right in to the meat of this really important and exciting conversation. Exciting because there is so much opportunity here. reflecting the real needs around the world. As Nicole said, I am with Organon. We're a global healthcare company with a focus on women, and we're in 140 markets around the world. We're only about 2.5 years old. We spun out of a larger company in 2021, and our core focus is addressing unmet medical needs of the 4 billion women and girls around the world, each of which we know holds a unique promise. But to truly address the health of women and girls, we know it takes more than the right medicines. It takes a holistic approach. And we've got to elevate those issues that maybe don't relate to our core products, but ultimately have such a big impact on helping women and girls reach their potential. And climate change, of course, affects everyone on this planet, but it also presents a growing and incredibly disproportionate impact on women and girls, and especially those in low and middle income countries. So in this lead up to COP28, there's been a lot of articles on climate change and health. As Nicole said, we're pleased that with this focus on health, there's a health focused day for the first time at COP. But the element that's missing all too often is also that intersection with gender, with women. And a lot of people don't know that during climate emergencies, women and girls are 14 times more likely to lose their lives than men. That is tremendous and incredibly tragic. To give another example, of the 33 million people affected by the disastrous flooding in Pakistan last year, 70% were women and children. Again, climate change is sort of a magnifier, if you will, for a lot of the disproportionate health effects and impacts that women already feel. Rising temperatures are a particular threat to women. They increase rates of maternal complications, and studies have shown that a staggering 46% increase in stillbirths happen during heat waves. So you get a heat wave coming in, the rate of stillbirths, boom, increases almost by half. Rates of unplanned pregnancy, rates of gender-based violence also significantly increase after climate disasters. But despite all these facts, current global funding, this group knows, for health, economic development, climate resilience is relatively fragmented. So there really is an opportunity to drive more integrated, climate resilient, and gender-informed investments in this area, both from the public sector and from the private sector. These issues aren't new, but that intersection is still very minimally addressed. So a lot of funders, partners step back and say, okay, well, what can we do given the clear need? And it's one of the reasons we at Organon were so excited to partner with YLabs. YLabs just has incredible credibility in the climate and the SRH space. And I think they've done a great job in really helping think through what would a cross-sector, cross-issue collaboration look like, and how do we accelerate the work to find solutions? So the outcome of our initial collaboration was the Climate and SRH framework that we'll be discussing today. And we think it's a fantastic guide for more sustainable investments with a gender and a climate lens. As I said in the beginning, at Organon, we know the importance of innovation. And we recognize that innovation can come from new medicines and therapies, but also to new and innovative approaches for bringing stakeholders together, across the spectrum to focus on these gender, climate, and SRH intersections. So thank you for joining us in this discussion today. I'm going to hand it over to my YLabs colleague, Dr. Addy, to walk us through the framework.
Thank you, Geralyn. for that very enlightening opening remark, I must say, and for touching some of the things I'll be talking about. Earlier today, I had to explain what this webinar is about to a 4-year-old. And after talking for about 10 minutes, she looked even more confused. Let's be honest, the link between climate change and its disproportionate impact on women and girls is not a simple topic. However, by the end of this webinar, I hope that, unlike my 4-year-old, that my team and I would have been able to help you have a better understanding of the intersection of climate change and sexual and reproductive health, and that you would have gained some clarity on how you can make a difference in this critical intersection. So let's get into it. Can I have the next slide? Can you all hear me well?
Yep, we can hear you.
Okay, so next slide. I'm still seeing the Organon slide. Can you go back to the slide before this? Thank you. Thank you. Climate change has been identified by WHO and the IPCC as the most significant global health threat of the 21st century. Frankly, I don't think anyone here needs convincing. Look at what is happening worldwide. The flood in Zambia, South Africa, and Nigeria, to the heat wave in the US. The impact is evident everywhere. However, it is crucial to know that this impact is not distributed equally. Geralyn mentioned this earlier. Women and girls, especially those that are living in low-resource countries, bear the brunt of these changes. And why is that? Women and girls constitute the majority of the global poor, and often they have limited mobility, they have limited agency, and limited decision-making power compared to their male counterparts. This pre-existing inequality and disparities constrain their ability to adapt to and recover from the impacts of climate change. So as we move on in this discussion, I want you to keep in mind the urgency and the need to address these disparities. Thank you. Since we released our framework in June, it's been amazing to see so much momentum on the intersection of climate and health. We are seeing reports, assets, thought pieces coming out from different partners and leading research bodies. An incredible momentum, I must say. However, one thing remains missing. You read through these reports and there's no mention of how women and girls are disproportionately affected. No mention of how gender equality will backslide and how sexual and reproductive health outcomes are affected. I was at the African Climate Summit and it was the same concern I had. Sexual and reproductive health and rights and gender equality was chronically overlooked in most of the discussions. And if we do not stress this enough and address these issues, we risk reverting back on the years of gains we have celebrated. This is not just a threat that we have cooked up. It is quantifiable. It's been projected that between 25 million to 1 billion people will be migrating due to climate change by 2050. And 80%, that is 8 of every 10 of this, will be women and girls. Also, reports have shown that if we continue with the business as usual, that is, we don't take any action, at least 14 million women will lose access to contraception over the next decade. What does this imply for us? Increase in unintended pregnancies, increase in unsafe abortion, and increase in maternal deaths. I need you to take a moment to digest the figures on your screen so that you get a good grasp of the magnitude of what we are discussing. Thank you. So let me take you through the impact of climate change on sexual and reproductive health and make this more relatable for you. On the screen is an example of how climate change indirectly affects sexual and reproductive health. As you look at this pathway, I want you to think of Leah, a farmer in Guji, a small village in Ethiopia. Guji was hit by a long period of drought, and Leah loses all her crops and livestock. Her source of livelihood is gone. She's unable to think of any alternative way that she can provide for a family. So what does she do? She gives out a 10-year-old daughter in marriage to one of the traditional leaders in the village. The dowry would help to put food on the family's table, and then it will pay their rent for the year. The girl that gets married, an expectation is on her to prove that she's fertile. So there you have it. Young girls getting married and having children early, compromising their health, losing their agency, losing their decision-making power, unable to negotiate if or when or how many children they want to have. There's more. The social pressure to comply with the cultural customs puts Leah in a position where she wants to make her other girls desirable for marriage. And what does she do? Female genital mutilation. And there you see how droughts can lead to an increase in FGM and increase in adolescent birth rate. This is not just a story. These are lived experiences and realities of countless women and girls worldwide that we captured from published literature. These are evidences of how women and girls, not just Leah, are disproportionately affected by climate change. Let me give you some examples. The latest UNICEF estimates report that more than 600,000 children dropped out of school as a result of the drought in Ethiopia. They also reported that after the drought, child marriage increased by an average of 119% across the regions that were hit by the droughts. Within the same regions, cases of FGM increased by 27%. This is just one report from Ethiopia, and we are seeing similar pathways in Kenya. In Nepal, for example, child marriage was reported to have increased by 73% after the droughts. That's 7 of every 10 women married before the age of 18. And this is just a preview of what to come if we do not do something. Even though this shows the problem, it also highlights for you the opportunity points for investments. As founders on this call, I would expect that you'll be asking yourself, how might I create alternative ways for farmers to water their cattle? How might I shift cultural perceptions around FGM being necessary for bride desirability? Answering these questions will give you pointers to create solutions that address climate change, climate and sexual and reproductive health. This is an indirect example. Let me take you through a more direct example. On the left, you see a selection of climate shocks, everything from cyclones, for example, the cyclone Idai in Mozambique, to extreme heat, rising sea levels in Bangladesh. You have cyclones and heavy rainfall destroying healthcare facilities. You have floods and droughts leading to displacement and migration. And this impacts leading to worsened sexual and reproductive health outcomes. For example, IPAS reported that the floods in Zambia and South Africa destroyed road infrastructure, including the bridges that linked the healthcare facilities. So they had the facilities isolated from the district health offices where essential drugs such as SRH commodities were kept. And what was the consequence of this? Women and girls could not access services such as contraceptives and safe abortion services. They were then forced to resort to unsafe methods, leading to an increase in unintended pregnancies, increase in unsafe abortion rates within these areas. Another example, a study that was published in 2018 reported that 20 million people in coastal areas of Bangladesh were affected by increased salinity in drinking water, which was found to be linked to higher risk of hypertension and preeclampsia in pregnant women. So you see how climate change directly and indirectly affects sexual and reproductive health outcomes, and how if we continue with the business as usual, if we continue and do nothing, these outcomes will get worse. I know we have people from different works and different regions here on the call, and I would like to hear from you. What are the other impacts of climate change on sexual and reproductive health outcomes that you have seen in your program areas? Let's drop that in the Q&A box now. What are the impacts of climate change on sexual and reproductive health that you have seen in your work? keep the answers coming in while I pass it on to my colleague, Nicole, to continue the presentation.
Thank you, Adedamola. Yes, please drop your answers in the Q&A function so we can kind of see them as they come in. But I think as Adedamola highlighted, you know, both directly and indirectly, climate change can risk and potentially reverse the impact of existing and future gender and SRHR investments in multiple ways, right? And we don't mean to double down on this, but we want to kind of take a moment here to highlight the risk of inaction or even a business as usual approach if we continue to approach these investments, these initiatives in the way that we have been previously without understanding that we're operating in a new paradigm because of climate change. So the first risk is that we backslide on outcomes. So many of the gains that we have made in pursuit of gender equality, that means reductions in child marriage, reduced maternal mortality, increased school attendance rates, contraceptive agency access, choice, use. There is growing evidence around the world that is showing that climate change is threatening how long these gains will hold true. The second is misdiagnosis. So if we do not approach our health and gender investments with a climate lens, we risk addressing the root causes and drivers of the barriers to programmatic or service delivery impact. Adedamola had highlighted a few of these in her examples previously. And the third is reactive funding. We do not want to wait until the next climate disaster strikes to take action. Humanitarian funding is limited as it is. And if we do not apply the scientific evidence on how climate impacts on vulnerable populations are manifesting and where they are increasing, our health investments risk being perpetually behind the ball, which will bring us back to the first risk. Next slide, please. But there is good news, and we promise that it is not all doom and gloom. And on the contrary, I think that this new paradigm that we are in brings a tremendous amount of opportunity to reimagine a world anew in the wake of climate change. So the good news is that when we make these kind of synergistic and integrated efforts in pursuit of both climate action, SRHR, and gender equality, we do have the opportunity to be an impact multiplier, to elevate the voices of women and girls and gender diverse people who, yes, are severely and uniquely impacted by climate change, but they are also incredible agents of change, innovation, and influence. And when women and girls have access to quality care, they are more resilient to the impacts of climate change and are more able to participate in leadership roles to build community-level climate resilience. Next slide, please. So the climate and SRHR framework was developed precisely for this reason, to support our audience, to invest and support in these kind of integrated investments in climate action and gender equality and women's health, so that we can achieve the virtuous feedback cycles that we have been mentioning previously. I would like to just, again, give another shout out to our incredible global group of advisory board members, some of whom are on the call here today, who were really instrumental in helping to develop this framework. And yes, I want to acknowledge that our focal audience for the framework originally was funding partners, but the evidence, the resources, and the investment guidance that are in the framework are incredibly applicable for a broader audience, for implementing partners, for researchers, and for advocacy partners alike. So with that, I'm going to turn over to my colleague, Theo Gibbs, who can talk us through initially how we can take action today.
Thanks, Nicole. Great. So I'm going to walk through with Nicole some of an overview of these key steps towards action. Make sure I can move forward the slides. Okay, there we go. Okay, great. So the 4 steps that we're going to walk through are these. So we've structured the framework around these 4 steps, and the essential process is assessing climate risk to SRHR and gender outcomes, building relationships with climate-focused stakeholders that you might not have relationships right now, supporting and initiating integrated projects at this intersection, and then critically measuring success, sharing what you've learned, and iterating on your approach. And we'll go through each of these at a high level, and all of this is in much more detail on the website, which is live and open to everyone. So the first step is to assess climate risk to your health portfolio, gender portfolio, or SRHR programming. And a special note to the funders that are listening in, the good news is that you don't have to wait to do this in 3 years until the next strategy cycle. We've structured this so that everyone can take action now, especially funders, by working with existing grantee partners or service delivery partners to assess what are the risks that are showing up right now on the ground. I know some folks are putting in the Q&A box right now some of the impacts they're seeing, and then make small tweaks today on the implementation model to address those risks in the short term. Within assessing risk, there are a couple of recommendations that we have. The first is to look at the climate data. What are the hazard risks and stresses that are happening in your focus regions or within your portfolio? Specifically, good places to start for looking at those models and data would be, for example, the World Bank climate risk profiles and the IPCC reports. Those will give you a national and regional focus. And there's various resources at a more regional or subnational level. The key point here is that when you're looking at climate hazards, we do recommend that you look at the full scope of impacts, not just those that have already been connected to health outcomes. And the reason for that is twofold. One is that the impacts on health may not be documented yet in the evidence, especially in the regions that you work. And the second is that looking at the full range of climate hazards allows you to see and anticipate possible connections between climate change and SRHR that, again, might not be elucidated or put forward in the evidence and the conversation right now. Then the next part is to look at how are those hazards predicted to change in the future, right? As Nicole mentioned, we don't want to be behind the ball. We want to be looking proactively at what's coming. And on that note, asking yourself, are there new hazards that the evidence indicates are predicted to emerge within the next decade or more? For example, the expansion of infectious disease range, such as malaria and Zika, which disproportionately impact or have gendered impacts on pregnant people, are predicted and are already expanding to new areas where the health infrastructure is not necessarily equipped to deal with that. Oops. So then the second step within this is to map how those hazards and current and potential hazards are or may affect SRHR outcomes. And as we've mentioned, the evidence in the literature almost certainly won't be there. There's some evidence which we have reviewed and is available on the website about how climate change impacts SRHR, but this is a very nascent space of research where we require more data is needed. So for you, when you're looking at a funding portfolio or your programming, there's going to be some strategic guesswork and inference needed. So to help you through that, some recommendations are that when you're mapping potential impacts on SRHR, we recommend taking stock of what are some of the vulnerability and resilience factors in the communities you're working with. That is, what are the things that hinder or support women and girls in adapting to climate shocks? And those could be physical, like houses being in a flood-prone area, or social, like a taboo against women and girls traveling without accompaniment. And then finally, it's important to take stock of what are the strategies that women and girls are already using to adapt. The impacts are happening now, so people are adapting. So how can you as a funder or implementer support and amplify those strategies that are already working at a community level? Okay, so I'm going to walk through one additional example to bring this together of mapping climate hazards to SRHR outcomes. So I imagine that many of you listening in work on contraceptive access and/or safe abortion access. So this is a case study, or this is based on a case study in Ghana, but has relevance to many other coastal regions. So if we're looking at, okay, what is the climate shock or the stress? One that might be present in a coastal region is rising ocean temperature, lowering marine ecosystem health. One of the impacts of that is combined with unsustainable fishing practices and from industrial fishing, there's lower household income for fishing families due to that declining marine stock. This might mean, and what we've seen in coastal examples, is that children in the family are receiving pressure to earn money to make up for that lost income. If there are a few options for income for girls in particular, which is often true, then that can lead to an increase in transactional sex that teen girls are engaging in for that income. And then that can result in higher rates of teen pregnancy when combined with the factor that we're all very familiar with of often a fear and a misconception around using contraception or going to a clinic due to social stigma. And that in turn can lead to increased rates of mortality and morbidity from unsafe abortion in teen girls when we combine it with clinical abortion services not necessarily being affordable, or girls using unsafe abortion methods at home due to that social stigma of going to a clinic. So here in this example, we can again see how a climate hazard that you might not necessarily from the beginning expect to be connected to SRHR ends up through this pathway leading to increased unsafe abortion use and mortality and morbidity from that. And with that, I'm going to pass it over back to Nicole to talk a bit about the next step.
Thanks, Theo. That was great. All right, so the next step is building relationships with climate-focused colleagues, reaching across the aisle. This is exciting. Next slide, please. So this is an intersectional problem. It will require cross-sectoral partnerships with both climate and health colleagues. And I would say that for those of us in the health sector, myself included, working with climate colleagues may be a newer partnership for us. But there is immense value that working with climate actors can bring to the table. So, and we kind of list a few of them here, but there are many more. But just to kind of like set the ground, first is just understanding the basic climate health interaction. So analyzing the impact of climate change on health, both the present day impacts and through climate forecasting trends. So really identifying vulnerable populations and regions now and in the future. The second is disease surveillance and control. So climate experts can help design surveillance systems that can monitor climate-related changes in disease patterns, which would enable more effective disease control measures. The third is, of course, unlocking service delivery innovation. This is going to be a big one. So climate experts can help explore innovative technologies that can enhance healthcare delivery in the face of climate change. So this could include telemedicine, mobile service delivery options, renewable energy solutions for healthcare facilities, and climate smart health technologies. And the fourth is financing, and this is a big one. Because as we all can appreciate, funding for the health sector is not limitless, whereas funding for climate action is actually exploding right now. I have just one example, but we have 25 countries and counting which have pledged to support the Green Climate Fund, with over $9.3 billion committed over the next 4 years alone. There is massive potential to unlock climate financing dollars to ensure that climate and health initiatives, which have been gaining momentum, as we talked about previously, do not lose sight of the importance of mainstreaming gender equality and women's health needs in adaptation and resilient efforts so that we don't backslide on the gains that we have made as a sector. Next slide, please. The next step is really just to identify who are the climate actors working in your geographic area of interest. What are they focused on? What skills and expertise do they bring? The framework lays out some steps and guiding questions to help you navigate this, but I want to call out two networks in particular here for those who are already ready to get started and establish these partnerships. So the first is the SRHR Climate Justice Coalition. They are a global network of more than 80 organizations across 45 countries committed to SRHR and gender equality advocacy in the context of climate change. The second group is the Climate Action Network. It's a global network of over 1,300 environmental NGOs in over 130 countries. So that's another great place to start identifying climate partners working in the Global South. Next slide, please. Another important consideration here as you are doing your kind of mapping is really to understand the climate health policy landscape and identify opportunities for influence. And this is especially important because as we speak, 70 countries are in the process of developing national adaptation plans. So this is policy action for enhancing country response to climate change. And it is very rare to see any mention of SRHR or gender equality in these planning processes, which is a tremendous risk from a policy and implementation perspective. So there is an immense opportunity here to partner with climate advocacy partners to mainstream activity plan and ensure that earmarked budget lines for SRHR and gender equality are in these NAPS processes so that we can safeguard women's health and equality in the face of climate change. And again, the framework really includes a ton of guidance on how to understand and navigate this cross-sectoral policy landscape. So definitely check out that piece. Next slide. All right, the third thing that our framework does is highlight examples of synergistic initiatives that align climate resilience and gender SRHR outcomes. And these are kind of investment areas that are mapped to the WHO building blocks of health. So these investment categories touch on everything from leadership and governance, so that's advocacy, to innovations in service delivery, bolstering the healthcare workforce, to research and development. So let's take a look at a few of them now. Next slide. Okay, the first is service delivery. So I think Adedamola had mentioned this previously, but by 2050, up to 1 billion people are projected to migrate within and across borders due to climate change. With 80% of this 1 billion people, these 80% of this displaced population estimated to be women and girls. So what do we think are the implications of this for service access? We are going to need innovations in mobile, nimble healthcare delivery and disaster response measures to meet the needs of people on the move or in crisis. So what this framework does is it outlines a series of investment opportunities in service delivery, everything from integrated climate and health programming that can combine SRHR service delivery with climate resilient livelihood options for women and girls, to tech-powered service delivery options like drone delivery of medical supplies, and equipping healthcare workers to assess, help mitigate, or respond to climate change impacts in their community. And we provide both real live case studies of actual initiatives on the ground addressing these issues, as well as illustrative ones as well. Next slide. The second piece here is on leadership and governance. So previously, we just talked about how over 70 countries are in the process of developing national adaptation plans, and the need to align ourselves and support local advocacy groups to mainstream activity plan and ensure that budget lines for SRHR and gender equality are included explicitly in these NAP processes. It's perhaps one of the most significant investments that we can make to safeguard gender equality in the face of climate change. And there have been really incredible examples of the success of this. So, for example, in the case of Kiribati, mainstreaming gender and SRHR into their NAP process supported healthcare systems to extend better coverage of SRHR and maternal health services, as well as improve the training of healthcare workers to proactively assess and manage climate change health risks. So it's already happening, and we just need to do a little bit more of it. Next slide, please. The final example here that we'll elevate today is health and climate research. So I think we mentioned this in the beginning, but we are seeing more global research coming out at the nexus between climate and health, which is awesome. But we need more localized data of the current and projected impacts of climate change on SRHR and gender equality in order to support more targeted allocation of resources and support policymakers with the data that they may need to develop more proactive and responsive strategies. YLabs is actually doing this already. We're working with youth, especially young women, across 4 countries to collect citizen-generated data via air sensors to understand the localized health risks of both air pollution and heat impacts, in order to catalyze more data-driven action and policy in partnership with city mayors. So I will now turn it over to Theo, who can talk about our final step, step 4, on measurement and evaluation, and bring us home.
Great, thanks, Nicole. So hopefully those examples give you a bit of excitement and energy around what's possible and also what's already happening. But I'm going to talk through the final crucial step, which is, okay, maybe you have projects you're already doing or new investment ideas. How can you start looking at measuring success and sharing that evidence for the sector? So the first step is to identify relevant metrics and indicators to track. And this is not an easy thing. So in the interviews we did with funders and implementers to inform the development of the framework, monitoring and evaluation was really one of the biggest stumbling blocks that we heard that people were facing. So there are quite a few of existing resources on assessing health system resilience to climate change, which is great. However, not surprisingly, there's almost no mention of gender or monitoring gendered health outcomes, such as SRH outcomes, within those existing tools. So we created this resource with the hope of helping fill that gap. And there's a lot more examples around M&E and guidance on the website, but I'm going to pull out just a few tips today. So the first tip is it's really critical to include process indicators when you're approaching your M&E framework for integrated climate SRH projects, not just outcome indicators. So conventional health systems, M&E frameworks are typically more outcome focused than process focused and often have predefined timeframes for impact. But climate change is an inherently dynamic thing with an unpredictable timeline. You might know that storm intensity is going to increase in the region you're working in, but you don't know whether that storm is going to happen this year or in 3 years. So if you have an investment that's, let's say, focused on reducing gender-based violence in the wake of extreme storms, but you're only tracking outcomes and there's no storm within your grant period, then you're not really left with much. But if you're tracking process, you can say something. So for example, you might measure whether whether or not district governments are including budget for creating gender segregated spaces within emergency shelters as part of their planning process in the event of an extreme storm. So you can use that to say, is there resilience that's being built into the system for the future? The second tip is to track data about environmental hazards, not just health outcomes. So again, typical health M&E frameworks typically don't incorporate information about environmental hazards, but in order to anticipate climate change's evolving impacts on health, it's really essential to track how environmental conditions are changing. So one concrete way to do this is to integrate environmental and climate data sets with your health data sets. So for example, indicators of hazard exposure, such as ambient surface temperature or precipitation, are often monitored by national weather services. And so those are existing data sets that you might be able to integrate into your M&E approach. And the third tip, it sounds obvious, but it's really incredible how much this isn't done, is to disaggregate data by gender and age. So in order to see the gendered effects of climate change over time, we need gender disaggregated data. And although you as a gender-focused implementer or funder might already do this, the call to action here really is to encourage partners, researchers, and government agencies to also implement that as standard practice so that we can build the evidence and monitor impacts over time. So as I said, there's a lot more details and tips on the website, but we know M&E is a complex topic, so we hope that's a useful resource for you. And then finally, so maybe you've mentioned you've measured some things, but then the critical final step is to pilot, share, and iterate. So there's no standard recipe, unfortunately, for climate resilient SRH programs, but we've created this framework to set the stage for the work to happen, and we are all figuring out together. So piloting and sharing what we're learning is really critical for collective progress. So for funders, a key recommendation is that we do recommend setting up flexible MEL systems with your on-ground partners and grantees. And that looks like having regular learning cycles, review cycles built in so that you can adjust data collection and monitoring over time, because we're working in a dynamic system with changing environmental conditions and health outcomes. And for both funders and implementers, the key point really is to expect that your implementation pathway is probably going to change in climate resilient SRHR programs, and you'll need to be flexible about the evaluation framework. So it's important to have an adaptive M&E approach and those rapid learning cycles in order to change and respond as needed. So with that, I'm going to take us home and open it up for questions. So just to summarize where we're at, and then please, you might have questions coming up, please put them in the Q&A box. So in summary, climate change is disproportionately impacting the health of women and girls, period. We know that. And we need to respond and proactively plan for that. So everyone on this call has a critical role to play in this critical innovation. The key things that we went through today and that you can do starting today, we don't have to wait, is assessing risk of climate change to your portfolio or your programming. Second is connecting the dots within your organization and within the spaces that you're in, whether that's COP or a health space or other conversations, bringing gender and SRHR into climate conversations and bringing climate considerations into SRHR and gender conversations. And then the third thing is to try things out, make some tweaks to existing investments and programming, adaptively measure and share what you learn. And if you're looking for new investments ideas, we do recommend checking out that section of the Climate SRHR website. And with that, I'll just end by saying that the website is live and you can check it out in more detail. The link is there. I think it's probably in the chat as well. And then we do, encourage you to reach out to us with any questions or feedback. This is an evolving resource, and we are excited to be continuing to build out this set of resources for climate-informed SRHR action in 2024. So if you're interested in partnering with us on this work or supporting this work, let's talk as well. And with that, I'll say thank you and let's have some questions. So put your questions in the Q&A, and I think Emily's going to moderate the questions that we answer. And I just want to thank everyone for joining us on this day.
Can you go back to the slide, or Katie, on that has the website link so that folks have that? Because I think the chat function for us might still be a little bit tricky, but the Q&A is functioning. Please drop your questions in the chat. Okay.
We have some good questions going here. Do we want to start with what are the best sources of current data on SRH, climate, and health that we should tap into to build the case for funding in this area?
It's a great question. I think it's a question we're asking as well. The short answer is, unfortunately, there's not one integrated data set on health or gender, SRHR, and climate right now. We wish that existed, and we're trying to move towards that. There are disparate data sets, and so right now, what we're providing guidance on is how to start to bring those data sets together, and then invest in projects that can create a more integrated data coming out of pilot investments. But yeah, there's not one data source at the moment. But I think what we're doing with the framework is building the evidence, and you can see in the explore impact section of the website, we've gone through and summarized what is the existing evidence around the impacts of climate change on SRHR. It's still limited. But it does exist, and we know both from on the ground experiences, from case studies, and also from published literature that climate change is having a diverse range of impacts. And we're going to be doing a more in-depth review and modeling of some of those impacts over the next 6 months. So we'll be excited to share that as well, so that we can all make that case together for the criticality of investing in this.
Thanks, Theo. Yeah, it looks like we have another question around, like, do you have any future activities planned as a follow-up to the framework, country level diagnostics publications, perhaps? I think you kind of mentioned that, but maybe we just expand on that question and that response. So as a follow-on to this work, we're going to be doing, again, like more of a global review and publication on the gendered impacts of climate change, looking at certainly SRHR, maternal health, and other kind of gender indicators. We're also, as Theo mentioned, going to be doing selecting some countries of focus to do some forecasting data, so to understand what are the impacts of climate change on specific SRHR and FP indicators now and in a 1.5 degree warming scenario and a 3 degree warming scenario. So that's going to be something that's forthcoming. And then we're also going to be, I mean, again, like as we're seeing today, there's a lot of initiatives happening at the nexus between climate and health. And so we're going to be putting together kind of a database that is an amalgamation of these initiatives, and then we'll be kind of cataloging the extent to which gendered considerations are being focused or mainstream in these climate and health initiatives, so that we can kind of clearly see where are the opportunities for investment at this nexus from climate adaptation, mitigation, and resilient efforts. So another, let's see, is there any other questions I can take here? Okay, we have one here. Maybe Theo, you want to take this? This is from Callie. So thank you for an excellent webinar and framework. How climate change impacts SRHR is increasingly clear, and the policy advocacy, financing linkages and actions are also clear to me. What is less clear to me is exactly what we should do differently in our SRHR programming in response. For example, we already have strategies to address transactional sex. So if climate change increases transactional sex, then we should do more of that. If climate change increases transactional sex, then we should do more of that work. But should the strategies we use change? And if so, how?
Yeah, it's a great question. And it's one that we're like thinking about and asking a lot. I think my answer is that it depends. So in the example that you gave, yeah, if you already have programming on transactional sex and your assessment of climate risk is that one of the potential outcomes is an increase in transactional sex, then great, you know that additional investment in that strategy will be important. But I think the key point is that the value of assessing what are the full range of climate hazards and climate risks is so that you can look and see, are there risks, potential risks and hazards that you haven't planned for that you need to adapt your strategy around. So for example, is there going to be expansion of infectious disease range such that there are new disease hazards or disease risks that you haven't accounted for in your strategy? Is there going to be an increase in displacement, climate-related displacement and migration within your region of focus or between regions of focus that you perhaps haven't accounted for yet, and that's going to change your service delivery model? Or is there going to be increased drought, which Adedamola walked through an example of some of the strategies or the outcomes of that. So so you might not necessarily need to, we're not saying you need to throw out your existing strategy. It's more just taking a closer look at what are the pieces that we need to keep and amplify, what are new things that we need to add, and then how do you measure and share how your strategy is effectively building climate resilience into SRHR outcomes for women and girls. So hopefully that's helpful.
Callie says, thank you. Okay, we have two other questions. So what are some interesting sessions, developments to watch out for at COP28 on the intersection of SRH and climate? I believe FP 2030 is having Well, I will say that it was, as everyone can appreciate, it was quite difficult, I think, for a lot of health focused folks to get their sessions kind of approved for COP. But I believe that FP 2030 is having a session, whether it's virtual or not, I'm not sure, on SRH and climate. So I think that would be one to watch out for. And there's another question here. What do you believe is low-hanging fruit and easy opportunities to integrate SRH and climate in funding and programmatic work? Anybody want to take that one? Low-hanging fruit.
I mean, I can jump in, and then I think the low-hanging fruit for me, where mine goes to, is building on the last question that came in. The low-hanging fruit is where can you tweak and amplify your existing programming? So you might it's looking at taking time to say, what are the climate risks, and where is our existing programming already providing some value and resilience, and just amplifying those strategies. And then, of course, if there's evidence that indicates that you'll need to build new programming or to make a significant adjustment, then that's going to be a heavier investment. But I would say the first step is to take stock of where you already have assets, where you're already building resilience, and where you can just tweak that in your existing portfolio. And then in terms of new investments that are low-hanging fruit, I would suggest we have a lot of different ideas and recommendations on the investment opportunities section of the Climate SRH website. That, what you see as low-hanging fruit might vary depending on what your current focus is, or in your programming or investments. But there are a lot of different options there, and we're happy to provide additional ideas.
Thanks, Theo. I think someone else actually responded with another kind of offer for the response, which is, I think a place to start would be partnerships, collaboration. For example, those already in SRHR programming, collaborating with other partners in climate action. So again, making a call for more cross-sectoral partnerships. So that's great. I think we are basically at time, and I want to be mindful. We've got about maybe 30 seconds left. So just wanted to thank everybody for their time and their contributions today. It was really wonderful to be able to spend the morning, afternoon, evening, depending on where you're calling from, with you all today. We just wanted to, again, mention that the climate framework is live. It can be found at climatesrh.org. Please do check it out, and please feel free to contact us at contact@ylabsglobal.org if you have any questions or follow-ups that you'd like to engage us on. So with that, and we wanted to thank, of course, our partners at Organon for joining us today and for their generous contributions and thought leadership on this work. It's been a tremendous opportunity in working with you and paving the way for future work together. So thank you, everybody, for joining.
Thank you all.